It's important to talk about it, not worry parents, just let them know.
Montrealer Stephanie Peillon wishes she knew then what she knows now about a rare post-COVID condition called multisystem inflammatory syndrome in children, or MISC. This was her daughter Rebecca in March 2021. She was one of the 283 Quebec children hospitalized with MISC since the start of the pandemic, according to the province's Public Health Institute. Stephanie is hoping to raise awareness on the risks of MISC.
The issue is not knowing that your child is so sick that you just figure it's another virus, it's another cold, she'll get over it.
For then 12-year-old Rebecca, the constant fever and neck pain she felt last year wasn't something she could just get over, but a doctor at the emergency room assured her mother not to worry and to wait it out.
It goes from bad to worse to horrid is that within the time span of 4 days, she was critical.
Rebecca never tested positive for COVID, but was believed to be suffering from MISC, something specialists started detecting just after the pandemic began.
We were seeing this type of illness about 2 to 3 times per month, and that those numbers during the bulk of the pandemic increased about 6 to 7 cases per month. And more recently, following Omicron, in January and February, we're seeing up to 9 cases per month.
Symptoms can include persistent fever, intense abdominal pains, skin rashes, bloodshot eyes, and in serious cases lead to inflammation of vital organs.
It is still a rare disease. After having had COVID, it occurs approximately 2 to 6 to 8 weeks following COVID. And if a parent is seeing these symptoms following having had COVID, then it's important to seek medical attention, only because the earlier the diagnosis is made, the better the prognosis.
Rebecca had a 6-week hospital stay and 2 stints in the ICU.
I was so sick that I didn't really know what was going on, or I was dazed and confused. I would never wish what we went through to other people, because it's you're at the hospital, right? And it's okay, yeah, that was the hospital. It's very traumatic. But then there's also, you live with that memory your whole life.
This is why Stephanie created a Facebook support group for parents to share their stories and get information, and has been distributing a flyer from the CDC in schools and pharmacies that shows the signs of MISC.
It doesn't mean that it's going to strike you. It just means that, you're informed and you can better take care of your child if it happens.
Rebecca is now almost fully recovered, with some minor neurological issues lingering, like headaches, confusion, and some memory loss. Her mother now hopes the Quebec government will join in on the effort to raise awareness.
I think it's time that we start talking about what our children can go through.
In Montreal, Alyssia Rubertucci, City News.